today?
Good, how are you?
Doing well. My name is Justin. I'm the pharmacist.
Okay.
All right. And are you Miss Jane Doe?
Yes.
Excellent. Do you have a few minutes I can spend with you?
Sure.
Great. I'm just going to spend a few minutes with you, about up to 5 minutes. That way I can go ahead and explain how to use this medication and some key points about it. I just want to confirm some information before I get started. Is your date of birth 12/11/57?
Yes.
Great. And just want to make sure your address is what we have on file for you at 1234 Wonderland Lane in Amarillo, Texas?
Yes.
79110?
Yes.
Perfect, great. All right, so the name of the medication today that you're going to get is turconazole. It's an antifungal agent. What did the doctor tell you about this drug?
I don't remember.
Not much? Okay, that's not a problem. I'll go ahead and explain it to you. It's turconazole. It's an antifungal agent. It's usually used to treat a yeast infection. And this particular one is suppository. And so it comes in a suppository form. And what you're going to do, according to the instructions, is each suppository is going to be 80 milligrams. And what you're going to do is you're going to insert that inside your vagina at bedtime for 3 days in a row. Okay? So there's going to be a total of 3 suppositories included in this medication. As far as administering the medication, it's really important that as soon as you take when you take it out of the box, it's going to be in a foil wrapping. You want to be sure to remove that foil wrapper before you insert the suppository. And then when you insert it intravaginally or inside the vagina, you want to make sure that you can push it back as far as you can without causing any type of discomfort or irritation. And then as far as the side effects go for this medication, you might experience some headache, you might experience some abdominal pain. As far as the local reactions, your vaginal reactions, you might have some irritation that might cause some itching or burning. If you do experience those, go ahead and stop the medication, call your doctor and let them know what's going on, and then they'll go ahead and discuss with you what they want to do from there, from that point forward. Again, if you also experience any type of fever, chills, or flu-like symptoms in general, you want to go ahead and let your doctor know as well. And if you are sexually active and you do use any type of latex condoms or diaphragms, it's a good idea that you use caution, because the medication itself, there's a certain component in the medication that actually might damage the condom or the diaphragm. And so just use caution if you are going to use those products during intercourse, that you're not using them at the same time with the medication, because it might cause damage to those products. So what I would probably do is during the course of the medications, go ahead and abstain from intercourse. That way you don't have to run into those issues. If you miss a dose for whatever reason and it's close to your next dose, you want to go ahead and just skip it and take it at the next scheduled time. As far as the monitoring goes, after the 3 days, the doctor might want to do another culture to see, to make sure that the infection has resolved completely. Also, monitor yourself again, because usually yeast infections will have burning, irritation, things like that. And so after the course of therapy, after the 3 days, you should notice improvement in those symptoms. So also keep tabs on that, and that way you can monitor yourself to see if you're improving. There's no refills, so it's just a one-time prescription. And as far as storage, you want to go ahead and store it at room temperature, away from sunlight, not in the fridge, just at room temperature. That you want to make sure that it's out of reach of children and animals. That way they don't get a hold of that medication. I also understand that you're taking lisinopril and Tylenol. There doesn't seem to be any interactions between those medications, so you should be able to take those as needed. And lastly, Ms. Doe, I just want to make sure I'm clear. Would you be able to tell me how you're going to take this medication?
Yes, it's a suppository that I insert vaginally for 3 days.
At bedtime.
At bedtime, okay.
Right, and the most important thing is you want to be sure to unwrap or you want to remove that foil wrapper before you insert the suppository.
Okay.
All right, so just one suppository intravaginally or inside the vagina, one time at bedtime for 3 consecutive days.
Okay.
Did you have any questions for me at this time?
No.
All right, if you do, just you know our number, it's on the prescription, and go from there. Oh, before I forget to ask you, do you have any allergies to medications?
Not that I remember.
Not that you remember? Great. Just want to make sure, because sometimes people have allergic reactions to this medication. I want to make sure that we got our bases covered. Again, if you have any questions, just give us a call or stop at the pharmacy and we'll be happy to help. Okay?
Thank you.
Thank you.
Good job, Justin.